Hello, I'm Dr. Lynn Butterly, and I'm here today to talk to you about taking the prep for your colonoscopy. You may have heard from many people that the preparation is the worst part about a colonoscopy, and for the vast majority of people, that's true. Therefore, we're here today to talk about some tips and suggestions that might make it easier for you to take the preparation for your colonoscopy and to do a good job, which is extremely important. Colorectal cancer is the second most common cause of death from cancer in the United States. Only lung cancer is more common in men and women combined. On top of that, colorectal cancer is one of the few cancers that we can actually prevent. There are two major concepts in terms of cancer prevention and early detection. One is preventing the cancer altogether. The other is detecting it early so that your survival is prolonged and treatment is more effective. Colorectal cancer gives us the opportunity not only for early detection, because finding a cancer early definitely prolongs your survival, but beyond that, with colorectal cancer, we can actually often prevent it from happening at all. And the way we do that is by finding small growths in your colon, called polyps, removing them and preventing them from having a chance to grow into cancer. So how do we do that? Well, the way we do that is that we do a colonoscopy, which is a test using a long, thin tube, approximately the size of your finger with a light on the end, bends in all directions. It looks through your colon or large intestine to find these small growths called polyps, and then we can painlessly remove them in a matter of seconds. There is no feeling for removing a polyp. And in that way, it prevents the polyp from having the opportunity to later grow into colorectal cancer. So that is true prevention, and therefore we want to make sure that our ability to do the colonoscopy and find the polyps is as good as it can be. So how do we do that? Well, a very important part of that is cleaning out the colon appropriately so that we can see clearly and find the polyps. As you might imagine, if you've ever had a sore throat, when you go to the doctor and they look at the back of your throat, it would be pretty tricky for them to see what that looked like if your mouth were full of food. So clearly we want your mouth to be empty of any food so that we can see the back of your throat. The same thing happens when you have a colonoscopy. We need your colon to be really well cleaned out so that we can find these polyps, even the small ones, and have the best chance at removing them, and therefore have the best chance at preventing you from getting colorectal cancer. So what we need in order to do that is a good preparation. And that's why we're here today to talk to you about some tips and suggestions about how you can get through the prep. Remember that whatever we say here may differ from instructions from your own doctor, and you need to follow the instructions from your own doctor's office. However, this will give you some tips and suggestions. You may discuss them with your physician if you think they would be helpful, and utilize whatever your doctor feels would be appropriate for you to use in taking the preparation. There are several different types of preparation for colonoscopy, but the one we're going to talk about today is a commonly used one, a 4-liter jug of powder mixed with water. I know it sounds daunting, but it is possible to get through this prep, and we are going to discuss some tips and suggestions to try to make that a little bit easier for you. Usually your doctor will send you a prescription and let you know where to pick up the preparation, and you will then receive, as we said, specific instructions from wherever you will be having your colonoscopy done. It's important to follow the directions given to you by the center that is going to be doing your colonoscopy. And remember that what we're discussing here today are just suggestions to make it easier. This is one way to do the prep, and you can always discuss them with your endoscopist if they seem to differ from the instructions you get in the mail. So you are going to pick up the preparation ahead of time. You also want to be prepared, have all your supplies on hand so that you're not running out in the last minute trying to get the things to make your test easier. So here are some suggestions for getting ready ahead of time. First of all, you're also going to be on what we call a clear liquid diet the day before your colonoscopy. Clear liquids are liquids that are clear. If you hold them up to the light in a glass, you can see through them. That's a good way to figure out if something is a clear liquid or not. So for example, orange juice filled with pulp is not a clear liquid. Examples of clear liquids that you do want to have on hand would be, for example, apple juice, white grape juice, ginger ale, other clear drinks, Jello, broth, bouillon. Those are really good because if you feel cold while drinking the prep, some broth or bouillon may help you to feel warmer. Some hard candies to suck on in between taking glasses of the liquid, and anything else that falls into a clear liquid category. If you have questions, your endoscopy center can tell you what constitutes a clear liquid and what doesn't. Other things you might want to have on hand are plenty of toilet paper, because this prep does involve spending some time in the bathroom, a magazine or book that you like, any special wipes to use if you feel that those make you more comfortable as you go along, and anything else that helps you to feel comfortable. It's only a few hours and you want to make them as easy as you possibly can. In general, the way people take the prep is to drink 1 glass every 15 minutes or so until they begin to feel full. Most people do begin to feel full after a number of glasses, and at that point, it's sometimes helpful to just pause, take a break, stop drinking for a while. You can walk around, take your time in order to help the liquid to pass on through. If you continue to try to force the liquid down when you feel really full, it can result in nausea or vomiting. That does happen sometimes, but this is one way in which you might be able to minimize that from happening. As you begin to work your way down through the jug, you will begin to notice as you pour glass after glass that fortunately the amount remaining is getting less. However, as people get about halfway through sometimes, they sometimes can feel discouraged. It feels like a lot to do. Just remember, the end goal is to have your colon be really clean so that the doctor can find all the polyps there are. So don't get discouraged. Take a little break. Walk around if you need to, and then come back to it. And you will know that taking the prep and having a successful colonoscopy has got to be easier than getting colorectal cancer. So keep that in mind. Try not to get discouraged. You will make it to the end, and when you do, your colon will be clear. Hello, I'm Dr. Lynn Butterly, and I'm here today to talk to you about taking the prep for your colonoscopy.